The healthcare industry has taken hit after hit as the pandemic continues to rain down on facilities across the state. Now those who serve and protect are helping battle back, and nursing homes in Woodville and Cornell are finally seeing some relief.
COVID really, it was extremely challenging emotionally and physically for everybody in healthcare.
The pandemic turning some on their heads and others away.
You know, unfortunately, we lost a lot of good healthcare workers in the process.
Creating a workforce gap and a dire situation. Overwhelmed facilities having to turn patients away, while others felt the brunt of isolation.
There are people that just didn't get into this business to be dealing with all of the changes in the rules and the regulations that went along with it, as well as the political part of it in regards to vaccinations.
But an unlikely ally is stepping up to the front lines of healthcare.
I'm still a little bit in shock that this is our reality.
The Wisconsin National Guard deploying troops to fight COVID as CNAs.
When I joined the National Guard 6 years ago, there was never a day in my career that I thought that we would be getting activated to work in a healthcare facility.
But we've seen it time and time again. The Guard providing aid at COVID testing and vaccination sites, and now hospitals and nursing facilities.
We are doing essentially the same as the other staff that work here. They're just a lot better at it than we are. We don't have as much boots on the ground time as they do, so we're still learning every single day, trying to get better and better at what we're doing.
It's part of an effort launched in January, and now 120 troops are trained as certified nursing assistants.
It's been like a collective sigh of relief here for our employees. Prior to them, we were not able to take any new residents from the hospitals, and that was a difficult position as well because we know they need the relief.
It's been very humbling, you know. I mean, it's heartbreaking and yet heartfelt to be able to be here and help the residents.
Look at you go.
We hear the residents every day saying, "Thank you so much for being here. We need your help. We needed your help for a very long time."
It's an experience Guard members say they'll never forget.
We were helping a resident use the bathroom. I had stepped out of the bathroom. I was just kind of looking at their pictures on the wall, and it was all black and whites and farm days and everything. And when we were done helping them use the restroom, you know, I just kind of asked him about it a little bit, and he said, "Yeah, back, and you know, that's all we did is we farmed corn and we had cattle." And I don't know why, but just listening to him talk about his family and how tight-knit things were back then and how different they are from today, you know, I don't know, that one sticks with me.
While others want to continue the mission.
Largely because of this mission, I've decided to go back and get my master's degree in healthcare administration.
Even when the assignment is complete.
The impact you can have on residents' lives, I think, has just been phenomenal. Knowing that healthcare is such a underappreciated and overworked industry, having the ability to help them is something that I think I'd be excited to be a part of.
And the National Guard will be providing relief to those facilities through mid-March.